Hi, this is Dr. Grace. Today's topic is ADHD. It's a short for Attention-Deficit Hyperactivity Disorder. And we are all familiar with the term ADHD. Sometimes you wonder if you have ADHD when it's hard to focus on different things that you have to do. In my years of experiencing children with ADHD, I have seen two types of ADHD. One is genuine ADHD. 1 hour with a child with ADHD who cannot sit still even in one-on-one quiet setting, whose hands are reaching out and touching everything. They can't sit still, running around the room. It's very exhausting. But I've seen some kids that we think has ADHD, but they can actually sit and enjoy the attention and do things that's fun and engaging. And I think, it's my opinion, many of the ADHD kids may be really children with poor discipline. And when you have a child who is not disciplined to sit still or do things that can be boring and uninteresting, they are constantly seeking to be entertained. Even in the classroom, the teacher can be too boring, the topic can be too boring, and they exhibit symptoms that looks like ADHD. So it can be a little fuzzy when we are diagnosing somebody with ADHD, but I want to just first today share the diagnostic criteria for ADHD. There are two categories in the area of attention deficit and the area of hyperactivity. So for attention deficit, these are the symptoms that we look for. They make careless mistakes. They have difficulty sustaining attention. They have difficulty completing work. It can be homework or classwork. Or if it's an adult, it can be just work. They are disorganized. They tend to lose things. And they are easily distracted. They are very forgetful. Now, the children may exhibit these behaviors as a young child, but these are, if it is more than their age average, and if there are more than 6 of these things that describes a child, they may qualify as a attention deficit with the inattention category. The other one is hyperactivity, impulsivity. Again, you are looking for 6 or more of these symptoms. They are fidgety. It's hard for them to sit still. They leave their seat when they're not supposed to be. And when they're supposed to be walking or it's inappropriate, running or climbing in an inappropriate place. And they have difficulty playing quietly. They are always on the go. They got a ton of energy that could really exhaust an adult. And they can talk excessively. And in a place where they're not expected to talk or raise their hands, they will blurt out answers. They have difficulty waiting in line or waiting for their turn. And they interrupt others. So these are some of the hyperactivity, impulsivity symptoms that we look for. And as an adult, or rather as you get older, the hyperactivity seems to go down a little bit. And as you get older, it might be more a case of impulsivity. So these are the things that qualifies somebody for ADHD, but these conditions must exist prior to age 12. In the past, it used to be prior to age 7. Now they have changed the age limit to age 12. And it must occur in 2 or more settings. So it happens at home, happens at school, or work. So it needs to happen in at least 2 places, 2 different settings. And then it must interfere with functioning in a social setting or academic setting or occupational setting. So this is the criteria for someone to be diagnosed with ADHD. And like I said earlier, hyperactivity may subside as you get older, but ADHD as an overall condition does not disappear. So you can be an adult and be diagnosed with ADHD, but I think it gets diagnosed in the classroom setting and school-age children because of the rigorous requirements at a school setting. I will continue in the next video.